Hi, welcome to Destination Baby. It's a new magazine series brought to you by Destination Newry. My name is Anne Harper and I'm a mum of two from the Newry and Mourne area. We're going to be dealing with any concerns, issues that affect mums and babies in the local area, so please do get in touch with us. You can use the comments box at the bottom of the screen or you can email us at Destination Newry. I have to state now very clearly that I am not a medical professional. Nobody that we're talking to is a doctor or a healthcare professional. If you have any concerns about your own health or the health of your family, please do speak to a doctor or your midwife or a healthcare professional. Don't contact us. Today I'm joined on the sofa by Anna McCann, who is a mum of two from Armagh. Anna had both her boys in Craigavon Hospital in the two separate maternity units in there, and we're going to be talking about her experiences today. Hi Anna, you're very welcome.
Hi Anne, thank you.
So tell me all about your experiences in Craigavon Hospital.
Well, like you say, I have two sons. My first son was born in maternity unit in Craigavon. I was consultant-led for the first birth, so he was born in the delivery suite.
Right.
I was overdue by about 10 days, so I was brought in for an induction.
Okay, sorry, I'll just explain in case anybody's not sure. Anna said she was consultant-led, and that means that her care was overseen by a doctor rather than a midwife, and so that's why she was having her baby in the delivery suite. There are actually two separate areas in Craigavon Hospital. There's the consultant-led care, and then there's midwife-led care, which we'll maybe get onto in a little bit. Sorry Anna, continue.
So I was brought in, obviously overdue, and I was given a hormone gel, to kickstart labour.
Right, so that was part of your induction, and one of the ways they can induce labour in a woman who has gone perhaps post-dates beyond her 40 weeks of pregnancy is that they can use a prostaglandin hormone gel to soften the cervix and help her get into labour. And Anna, that's what happened to you. Yeah.
So I was, at the time I was monitored, my tummy and all was monitored, and the baby was monitored, the heart rate and everything was kept monitored, and the gel pretty much started working straight away. After a couple of hours, my waters actually burst, so that was the onset. Then I knew definitely something was happening. So throughout the night then I just had the contractions, and also the labour was fairly well established, and in the morning then the midwives came. They would do sort of their checks in the morning to see how I progressed, and at that stage I was about 7 centimetres, so I was a good candidate to go downstairs to the delivery suite.
So when Anna was induced in the hospital and you were in a ward or a room, what was the setup there when you were being induced?
Yeah, I was in the ward. So at the time there was two of the mums there as well. So they had obviously the same. They were overdue mums who'd been induced. So everyone was waiting for babies. Yeah. So I was the first one. I was lucky. So I was taken down first. Right. So everything worked quite well. I suppose my hormones must have been quite good. So ready to go then. So I was fairly ready. So it was quite quick for me. So I went down to the delivery suite around 7 in the morning.
Okay, and then what happened? You were in labour. I was in labour. How were you coping? What coping mechanisms did you have?
My husband was there with me. He came straight away. They gave him the call first thing, and he came. And literally it was just gas and air. I kind of wanted as much of a natural birth as I could, so I was hoping just for natural sort of gas and air and breathing techniques, visualisation techniques.
Did you find those were effective for you then?
I did find the breathing. I had in my head an image of breathing, helping to push the baby down with every tightening and breath. So I read a book beforehand. So
do you mind me asking what book?
Hypnobirthing.
Hypnobirthing. And you felt that it was really beneficial?
I did, yeah. Loads of yoga kind of breathing and relaxation, I think, is the key to try and help with the pain.
Sounds like you were on top of it.
So everything sort of went quite quickly then. He was born around 11 o'clock in the morning, naturally. So it was more of a clinical situation, because there were
a more clinical setting, yes.
Midwives and nurses.
And were you joined, your husband was there with you? Who else was in the room then when you did eventually?
My husband was there, but happened at the time my sister was visiting from England, so she was intermittent. The two of them would sort of be in and out just to see how
tag teaming.
But mainly my husband was there. So.
And was it a midwife in the end who helped you whenever you came to bring your baby?
I think it's because it was more sort of clinical, because it was a delivery suite. There was a midwife, and I think there was a nurse, and the consultant at that stage came in sort of more towards the end of the stages. And so when my son was born, I think there was 3, and I had a medical student there too. So I had about 4
You're a popular lady then. Very good. Well, we actually have some video of Daisy Hill consultant-led unit, which we can cut to now. So just to give you an idea of what the more medical kind of consultant-led end of the maternity services here. It's not actually where Anna gave birth, it's the one here in Newry, the Daisy Hill unit, but it'll give you some idea of what's available and what the situation's like if you do end up having your baby in Daisy Hill. So we'll just go and watch that now.
The actual assessment room in the assessment unit, or one of them, where you could be taken to assess the condition of yourself and your baby.
Okay, yeah.
Don't be alarmed by the equipment, that's just for checking your blood pressure, and that's just if we need to monitor the baby's heart rate and your contractions.
Oh, okay, so this is where I'd come first then.
This is where you'd come first, and then a decision will be made whether it would be appropriate for you to go home and await events, or whether you would need to be admitted directly to delivery suite, or whether you would need to be admitted to maternity floor, to one of the 4-bedded units there on the antenatal side. Now Emma, these are just the outer doors of delivery suite here, and you just come on ahead in then. This whole area here is the delivery suite, and first of all, because we're in a clinical area here, we'll sanitise our hands. Now, it's very important to do that here, and this is our birth pool room. There's quite a bit of equipment in it, but don't be alarmed, we need this for the purposes that we're prepared for absolutely anything that happens. This is the bed, but we normally like to keep you up and about and mobile as much as possible. You don't have to be standing upright all the time, but you can actually, you can lean over the bed, you can, but just stay moving about as much as you can. We do have a rocking chair that you can actually sit on. It's about gravity helping you and helping get the baby into the right position. Now these are some of the other aids that we have here. We have the mat here that you can go down on all fours. But as I say, you don't have to go down on all fours because our bed actually will let you do that. And this is the ball, which is absolutely excellent for you to sit on, and you can actually bounce up and down on this ball, and this also helps to get the baby into the right position. And as you can see, most of our ladies sit on and find this very, very good, very relaxing. And we usually have daddy behind, just to make sure that you don't bounce off. This is our birthing stool here, which is very good for getting the baby's head down into the right position for delivery. This is the pool here. This is the dominant feature of this room, because this room is for low risk ladies, let's say. That's somebody that hasn't had any medical problems or any problems during their pregnancy and have come in spontaneous labour. Water is a very good form of pain relief. Some people talk about it being the aquadural, that they find it very good to relax. Before you even get in here, you can use water at home in the early stages of your labour, or you can use the bath. There's baths upstairs. Pain relief that's available when you're in the pool is the water itself, and some people find that enough for them, and it just helps to relax them. Or we can use the Entonox, and the Entonox is piped with one of the tubes, that you breathe it in and out through your mouth. Okay. And it's not accumulative. Once you stop breathing, it goes away, so you're not building anything up with the baby. And a lot of people find that adequate. Now, if you find that you're needing more pain relief, and you need something like the pethidine or the diamorphine, which are given by injection form, then we need to take you out of the pool before we give it to you, and for the duration of that. Yeah. But you can still be mobile, you can still be upright, but it tends to make you quite sleepy. Okay. And then if you still find that that's not adequate, then you may need epidural, but we wouldn't administer an epidural in this room. We would use one of the more clinical rooms for that.
So with the birthing pool then, it would just be myself then in the bath?
Yes, just yourself in the bath. Now, as I say, if you had a particular preference for your partner to be in with you, I'm sure that could be looked at the time, providing he brings his swimming trunks with him.
And it's easy enough to get in and out of then?
They have the steps here to get you in and out of, and you can sit up at any time, but if you want to, we can give you a wee hand to sit up as well. Yeah. The only thing I would say to you, if you're thinking of using the water, bring an old t-shirt or a bra or something just to wear, because your nightie isn't suitable because it'll be absolutely drenched. So something that covers your modesty. We don't mind, but usually most ladies don't like to be completely exposed in the pool. We have our cot here when your baby arrives. This is our wee sonicade that we listen in. If you're in this room, you're a low risk lady, so therefore we listen in intermittently.
So as you could see from the video of Daisy Hill, a lot of monitoring equipment there, some of which you experienced then when you were being induced. Yeah. But also some options to use more natural forms of pain relief like water and even gas and air, which doesn't really affect the baby. Because it's very short-lived. So, and Daisy Hill, I believe, have recently, in the last year, changed their policy now. So a low-risk woman All low-risk women are now midwife-led rather than consultant-led care in Daisy Hill. So unless there's a pre-existing health problem that you have, or a problem crops up when you're pregnant, everybody is now getting midwife-led care in there. So those sort of more natural options for pain relief and being active and so on in labour should be available to you. So that's really good news.
Good,
yeah. So Anna, tell me all about the next experience that you had in Craigavon, which was different.
Yeah, midwife-led second time. I actually was in labour, so I arrived at the hospital.
So can we just explain a little bit about midwife-led care, because we've talked about consultant-led care. What does midwife-led care mean? Well, I'll tell you, it means that a doctor doesn't oversee your pregnancy because you're considered to have a normal pregnancy, and you will be taken care of by a midwife during your pregnancy and during your labour and for the birth of your baby. All being well, most low-risk women will now be midwife-led. So you were midwife-led, and you ended up in the midwife-led unit at Craigavon. Can you tell us about the unit?
Well, I had gone into labour when we'd arrived at the hospital, so I was met by midwives.
So you were already in labour?
I was already in fairly well in labour at that stage.
And you were completely natural labour, no induction?
Yeah, a day early, so it was a surprise after the last guy was 10 days over, so a day early, started getting all the labour pains, went to the hospital, my waters broke as we arrived at the hospital, so pretty much then I was taken straight up. I'd asked for midwife-led, so I was taken up to the midwife-led ward, and then pretty much from there encouraged to sort of move around, make whatever.
So what's the midwife-led unit like? I mean, we have a video which we'll watch in a minute, but tell us more about what your experience was like. Did you have, you sharing a room? Were you in a room on your own?
They're single rooms, so it's a room on my own with kind of a bathroom off to the side.
Right.
It was kind of more homely, so there was like a little chair there and a settee, and the bed and all was there, but I was sort of more inclined to move around a bit more in that room.
So because of course you weren't being monitored,
no.
But were they assessing your pregnancy in any other ways then?
Yeah, so the midwives would be checking with handheld monitors the baby to make sure everything's okay, and there was some examinations, but I wasn't attached to any equipment. I was able
free to move
around and do whatever, encouraged to do any movement that I wanted. So I was there for a couple of hours, and then my son was born, so he was quite quick compared to the first birth. It was very quick,
so very different,
very laid back, a bit more relaxed and laid back. Maybe second time round I was more relaxed, but it was more of a relaxing atmosphere, just myself.
And did you use the sort of skills that you'd obviously talked about earlier? You did some hypnobirthing and so on. Was that helpful?
Yeah, they were still, I was kind of more expecting, I knew what to expect probably second time round. So, and obviously my body had done it once before, so it was a bit easier maybe second time round. I had to use some gas and air just with some of the contractions through, because there's gas and air available in that room.
And if you don't mind me asking, when you eventually did give birth, what position were you in whenever, I was
actually on the bed lying on my side.
Right.
That just seemed to, I don't know why.
That was the most comfortable place for you to be.
Worked for me.
But they were happy to go with whatever was more comfortable.
Whatever was more comfortable for me. Yeah.
That's great.
I tried all different positions, but that I just seemed to kind of, in the end, it was quite quick. It was about 2 hours from when I arrived, to when he was born, so it was quite quick.
So we saw quite a lot of other equipment in that video, the ball, the pool. You didn't avail yourself of any of those.
Didn't have time.
Options. Didn't have time.
No, but I would have had a ball and everything at home, so I would have been aware of that. Would be a great thing to set, get the baby in the right position. So I was aware of all that, and hip rocking, and but I didn't have the time that second time round. Just didn't have the time.
And did you feel then that they encouraged you to do your own thing when you were in labour? I hear of women saying, I wanted to do this, but I had to do that, and that kind of thing. And I wonder, how did you find the second experience? Was it more liberating, I suppose? I don't know.
Yeah, it seemed to be a lot freer, if that makes sense. It was a lot more, if I asked something, it was like, whatever you want, whatever you're comfortable with, how can we help you? So there was 2 midwives, and myself and my husband, so it was a lot quieter, a lot more relaxed. And because I suppose you're in a room on your own, it's you are kind of away. It's almost like you're sheltered away from all the other. It's like a normal, like the delivery.
It's more
ward.
private.
Quiet. It's quieter, so you're more able to focus on the job, I suppose, and you're more relaxed.
It sounds very nice. Let's have a look at a video of Craigavon midwife-led unit and see what's available in there.
Okay, Kerry, well, this is one of our suites here in the stay. We look on labour here as being a perfectly natural event, not an illness, but a normal physiological event. And if everything is deemed to be okay with you and your baby, and you're in labour, and there's absolutely no problems, then this might be an area environment that a woman labours in, sort of feeds into her ability to relax, to reducing her tension, and all of that perhaps helps her to feel more in control.
Just the CD player when I came in, so you can very much make this as much as your own, bring your own music in, anything that's going to relax you, really.
Anything that works for you, and quite frankly, whatever your musical tastes are. It's all about relaxation aids, and it's all about creating an environment that's conducive to your relaxation. The birthing mat, you might want to use that. You might want to use the beanbag to adapt different positions. You might want to use birthing stool.
And all these things, the birthing ball, the birthing stool, the birthing mat, women find these work. They're
Absolutely. I mean, it's a personal preference. There's no right and wrong. It's whatever works with you or for you. The parameters always being safety. But adapting different positions in labour is very important, and it also gives you a feeling of being in control in your labour, and the midwives will encourage that. You also might want to consider the use of water. It's the person best placed to advise you about the use of the water is the midwife in attendance with you during your labour. And absolutely, women find it invaluable during the course of their labour. In this department, we have a piped supply of Entinox, which you might know as gas and air, and you can continue to use that when you're in the water. And that's very relaxing.
it's reassuring as well.
Absolutely. We can continue to check the baby's heartbeat with the little sonic aid. You just bring your tummy to the surface of the water and they can check it like that.
So Anna, we saw on that video, it's a really nice room you get in the MLU.
It is nice. It's a nice ensuite room. You have your own back room, you know, with lots of mirror space and things for your own belongings. You can bring a lot of things from home there, so it's definitely more relaxing.
And also the options then for things like nice music and to dim the lights and so on. And I know that studies show very clearly that women birth, the hormones of birth work best when you feel relaxed, when you feel at home, and that's when things go better. And I mean, I don't like to draw a comparison, but it's very different to listening to the beep of a monitor if you're listening to the sound of a music that you like, I suppose.
It was very relaxing in the midwife-led. It was nice.
That's really good. There was the big birthplace study recently that was published, which showed that low-risk women, home from home units and midwife-led care led to the best outcomes for those women. So it's kind of very positive to find that in the local area now, both Daisy Hill and Craigavon, if you're low risk, you will be expected to take the route of midwife-led care. But that doesn't mean that your options for things like pain relief, which is something that really worries mums, you know, you can still have pain relief if you go down the midwife-led route. I know you just had gas and air, but certainly in my first birth, which was in a midwife-led, you know, I did have pethidine, and you can have, you know, everything I think except an epidural, but obviously you'd have to speak to your midwife about your pain relief options. But so for low risk women, you can have midwife-led care, and the options look pretty nice, I have to say. So yeah, you find it more private,
quiet, relaxing, more like a home from home really. Yeah, there's just myself and two midwives, so there's a lot more. I mean, there's more time to talk, I suppose, to ask questions, to feel relaxed and supported.
And you didn't have time to use the bath or get into a pool?
I had a lovely bath the next day.
Oh, great.
Which was lovely because it was obviously private.
Well, you need to make the most of the suite while you're there.
It was, yeah, because my son was in the room obviously and he was close to me, so it was great for me.
So he was roomed in with you, and you didn't have to leave after you'd given birth. Then you were still in the same room.
And with my own, almost brought my own hairdryer. I brought everything from home with me, and I made as much of, you know, the time that I could afterwards just to sort of relax.
Because you by that stage had another one at home, so
I was going home to
you're making the most of the tea and toast. Yes, I can understand it well. Yeah, that's great. But obviously you were more active, and you were able to give birth in the way that felt best for you, which is really all any woman wants, isn't it?
I mean, my son was quite a big baby, so with the fact that it was very.
Do you mind me asking how big he was?
He was 9.2 £.
Happy days.
So he was born he was a very long baby too, but and it was a really relaxing. It actually was quite a relaxing experience.
And it sounds like you actually enjoyed it quite a lot.
Well, I was more nervous, but I mean, you know, it was what I wanted, if you know what I mean. It kind of empowered me because it's like I could do that, and I got the breathing thing down with the help of a midwife. She'd sort of help me with
And did you bring any music with you? Had you got it all prepared?
I didn't have any music, no, but I bought books and things thinking I'd have time to relax and read, but it was lovely. It was nice and friends.
Sounds like you were going on holiday. Pack my
Friends who
books.
come in and visit. It was a nice sort of it was a nice
It was a nice
experience.
environment.
Yeah, it was nice.
It was a really positive
Yeah.
experience. That's great. And I think it's really important to know that if you're not able to avail of the suite in the midwife-led unit and you're high risk, there are things that you will be able to do to make your experience really positive and more relaxing. And I think that we'll have to come back to this in a future edition of Destination Baby and talk about those things, because some of us won't have a breeze, but we can make it as best as possible. So and we'll come to that in future. So tune in again and we'll see you next time.